Hello, good day. Herewith I will talk about our study entitled The Correlation Between Cardiopulmonary Bypass Time and Lactate Levels and the Length of Stay in Intensive Care Unit in Post-Operative Patients of Coronary Artery Bypass Grafting Surgery. This study was authored by Sulistiyari Bayu Utami, Tiga Adi Pratama, Imam Susano Bayu Adi, and Satrio Adi Wijaksono. As a background, coronary artery bypass grafting surgery is one of surgical management for coronary artery disease, or CAD. Hyperlactatemia in CABG is associated with poor post-operative outcomes. The aim of this study was to correlate cardiopulmonary bypass time, or CPB time, and serum lactate levels to the length of stay, or LOS, in intensive care unit, or ICU, in patients with post-CABG. Methods. This was a cohort study in 358 patients with post-CABG from January 2016 until December 2021 in Dr. Karyadi Hospital, Semarang, Indonesia. Subjects were selected by consecutive sampling. The correlations between CPB time and serum lactate levels, between CPB time and LOS in ICU, between serum lactate levels and LOS in ICU were analyzed by non-parametric Spearman correlation test. Subjects were then divided into two groups, in which group with lactate levels less than 4 millimole per liters and with more than 4 millimole per liters. The differences of loss in ICU were analyzed within both groups with non-parametric Mann-Whitney test. Results. There were correlation between CPB time and serum lactate levels in ICU with R 0.302 and P 0.000 between serum lactate levels and LOS in ICU with R 0.194 and between CPB time and LOS in ICU with R 0.373. There was a longer CPB time in group with lactate levels more than 4 millimole per liters compared to that with lactate levels less than 4 millimole per liters. There was a longer LOS in ICU in group with lactate levels more than 4 millimole per liters compared to that with lactate levels less than 4 millimole per liters, although it wasn't significant. As the conclusion, there were correlation between CPB time and LOS and between serum lactate levels and LOS in ICU in patients after CABG. If confirmed by further findings, lactate levels might be a predictor for the outcome for patients after CABG, including a longer LOS in ICU. Thank you.